Chagas disease, also known as American trypanosomiasis, is a potentially life-threatening illness caused by the protozoan parasite Trypanosoma cruzi. So Chagas disease is named after Carlos Rivero Justiniano Chagas, a physician and researcher who discovered the disease in 1909. About 6 to 7 million people worldwide are estimated to be infected with Trypanosoma cruzi. The disease is found mainly in endemic areas of 21 continental Latin American countries, where it has been mostly transmitted to humans and other mammals by contact with feces or urine of triatomine bugs, known as kissing bugs, among many other popular names depending on the geographical area.
So now let us proceed to the host range of Chagas disease. Chagas disease, in American trypanosomiasis, it is caused by infection with the protozoan parasite Trypanosoma cruzi, which displays a complex life cycle involving human and animal hosts as reservoirs of disease and triatomine insects of the Rhidovidae family as vectors. So we clearly understand that Chagas disease is only hosting to human and animals and not in plants and other organisms. And now let us talk to the pathogenesis or mode of infection and transmission of this disease. So the distribution or the infection. Chagas disease was once entirely confined to continental rural areas of the region of the Americas, excluding the Caribbean islands, due to increased population mobility over previous decades. Most infected people now live in urban settings, and the infection has been increasingly detected in the United States of America, Canada, and many European and some African, Eastern Mediterranean, and Western Pacific countries. And to the transmission or in the transmission of this disease in Latin America, T. cruzi parasites are mainly transmitted by contact with the feces, urine, or infected blood-sucking triatomine bugs. These bugs typically live in a wall or roof cracks of homes and peridomilitiary structures such as chicken coops, pens, and warehouses in rural or suburban areas. Normally they hide during the day and become active at night when they feed on animal blood, including human blood. They usually bite an exposed area of skin, such as the face. Hence, it is common name kissing bug, and the bug decays or urinates close to the bite. The parasites enter the body when the person instinctively smears the bug's feces or urine into the bite. Other skin breaks the eyes or the mouth. So that's all for the transmission, infection, or the distribution of the Chagas disease.
Control and prevention. There is no vaccine to prevent Chagas disease, but vector control has been the most effective method of prevention in Latin America. The control target are elimination of the transmission to humans and early health care access of the infected people. Recommended of World Health Organization is spraying of dwelling and surrounding areas with residual insecticide, house improvement, and house cleanliness to prevent vector infestation, personal preventive measures such as bed nets, good hygiene practice in food preparation, transportation, storage, and consumption. Screening of blood donor because it is important, because it is necessary to prevent infection through transfusion and organs transplantation, and to increase detection and care of the affected population all over the world. And testing of organ, tissue, or cell donors and receiver. Screening of newborns and other children of infected mothers without previous antiparasitic treatment to do early diagnosis and provide treatment. Sign and symptoms. Chagas disease present in two phases, the acute phase and the chronic phase. In the acute phase, has a high number of parasites circulate in the blood, but in the most cases, symptoms are absent or mild but unspecific. The second one is the chronic phase. The chronic phase has the parasite are hidden mainly in the heart and digestive muscle. In areas of Mexico, Central America, and South America, where the Trypanosoma cruzi parasite is present in try to mine bags, to improve housing and spraying insecticide inside the housing to eliminate the bugs has significantly decreased the spread of Chagas disease. People bitten by tritomine bugs, characteristic first visible sign can be a skin lesion or upper place swelling of the lids of one eye. Sign and symptoms of Chagas disease: fever, headache, enlarged lymph glands, failure, muscle pain, difficulty in breathing, swelling, and abdominal or chest pain.
To kill the parasite, Chagas disease can be treated with benznidazole or nifortimox. Both medicines are nearly 100% effective in curing the disease if given soon after infection at the onset of the acute phase, including the cases of congenital transmission. The efficacy of both diminishes, however, the longer a person has been infected, and the adverse reactions are more frequent at older age. Treatment is also indicated for those in whom infection has been reactivated, for example, due to immunosuppression, and for patients during the early chronic phase, including girls and women of childbearing age before or after pregnancy. To prevent congenital transmission, infected adults, especially those with no symptoms, should be offered treatment because antiparasitic treatment can also prevent or curb disease progression. In other cases, the potential benefits of medication in preventing or delaying the development of Chagas disease should be weighed against the duration of treatment up to 2 months and possible adverse reaction occurring in up to 40% of treated adult patients. Benznidazole and nifortimox should not be taken by pregnant women or by people with kidney or liver failure. Nifortimox is also contraindicated for people with a background of neurological or psychiatric disorders. Additionally, specific treatment for cardiac or digestive or neurological manifestation may be required.
According to the previous discussions, Chagas disease can be transmitted by a vector through insect feces, vertical or congenital from mother to child during pregnancy, blood transfusion, and other transplants. Oral, accidental laboratory exposure. This time, may I ask, what do you think is the most affected organ targeted by this infection? It is, of course, you're right, the heart is the most commonly affected organ in persons with chronic Chagas disease. Autopsy may reveal marked bilateral ventricular enlargement, often involving the right side more than the left, in the heart of patients who die of Chagasic heart failure. We can prevent Chagas disease by avoiding sleeping in a mud, thatch, or adobe house. These type of residences are more likely to harbor tritomine bugs. We have to use insecticide or soaked netting over your bed when sleeping in thatch mud or adobe houses. Use insecticides to remove insects from your residence. Third, use insect repellent on exposed skin too. Let's all work together to beat Chagas disease.